Do you ever get random spasms in your low back that knock you down to the floor? Constantly worrying about whether our back is going to flare up is one of the worst feelings in the world, and it keeps us from doing the things that we love. And the root cause of this problem might be an often overlooked muscle, the QL muscle, or Quadratus Lumborum. The key to lasting low back and hip pain relief is to first get out of pain and then strengthen the muscle so it doesn't go through this again. So in this video, I'm going to show you a quick 5-minute routine that you can do to release the QL muscle and then strengthen it for long-term support. So what is the QL muscle, or the Quadratus Lumborum? This muscle runs from the lowest rib down your spine and then inserts at the top of your pelvis. Because of this, it plays a large role in stabilizing your pelvis, moving your spine, and allowing you to bend from side to side. Now, because of the important role that the QL muscle plays in the stability of your spine, there are two common problems that we run into. When the QL gets tight, which often happens when we're sitting for a long time, like a lot of us do when we have office jobs, it can pull on your low back, which often feels like it's pulling around your waistline or even down into your hips. And then when the QL is weak, it then can't properly support the spine, which leads to fatigue in not only itself, but other muscles that work together to keep our spine strong and stable. So this creates a painful cycle. The QL tightens up because it might be weak, or because it's weak, other muscles get tight. Either way, there's more pain. But the good news is that with just one stretch and one simple strengthening exercise, you can break that cycle and begin to start feeling better. So let's get to the exercises. But first, here's a quick disclaimer. So for this first stretch, we are going to be working to get relief and help the muscle feel less tight. Because of course we want to get pain down before working to strengthen the muscle. So for this exercise, you can do this seated. And what we want to do is we want to find a place to sit where we can put our hip slightly off to the side over the edge of where we're sitting. We want to have good posture while we're doing this. And when we let our hip drop, we want to try and relax that side, the painful side, as much as possible. We're going to use gravity to help us with this stretch, and then we're going to do a little bit of work ourselves. Next, once we've gotten into a good position, we want to raise our arm over our head on that same side. And then while we're doing this, we're going to slowly lean away from the side of our pain. So if it's our right side that hurts, we're going to lean to the left. If you don't feel anything with this, that's okay. From here, once we've gone as far to the side as we can try and lean forward a little bit, bending at our hips. And from there, we should feel a gentle stretch. Make sure throughout this that we are moving slowly and that we're always breathing. Never hold your breath. So as you're doing this, you should feel a long, deep stretch from the bottom of your ribs to the top of your pelvis or your hips. This means that the QL muscle is releasing. So we're going to hold this for 20 to 30 seconds. And while we're doing this, we want to make sure that we're relaxed in other parts of our body. Make sure that we're not tight or clenching our shoulders or any other muscles. Now we're going to come back to the center, and if you feel tightness in both sides of your body, you can definitely do this stretch on either side. If we only feel it on the one side, we can just do this 3 to 4 more times on that one side, and then we are finished. All right, so once you've done 3 to 4 of these for 20 to 30 seconds, we are going to go on to the next exercise. Now, there's one important tip I want to mention, and that's that we should never push through the pain. We should only feel a gentle stretch, and if we feel like our muscle is about to spasm, that's a warning sign that we should back off. We don't need to go any further. We always want to build and stretch to the point where we're feeling a deep stretch, but never like we're forcing ourselves to do more than we can handle. All right, so now that we've loosened the QL muscle and gotten some relief, we want to work towards strengthening it and building up its resilience. Deliberately strengthening the muscle helps rewire the brain, nervous system, spine, and muscle connection so that the brain and body understands that the muscle is safe to move and it doesn't need to spasm. That's what strengthening does for us over time. This also helps other muscles around our spine stay stable and not be overworked because the QL muscle might be weak. We want it to be strong. So for this exercise, you'll need a small step or a platform. For this exercise, I'm doing it very small and using just a book to stand on. You'll want to stand with your right foot or the painful side on the book, and our other side, the non-painful side, is the one hanging over the edge. We then want to keep our core tight and our shoulders as level as possible. Then we're going to drop the non-painful side, so the opposite side, down to the floor. Then, once it has dropped, we are going to recenter or bring up our hips and our pelvis back up using the muscles in our core, which is mostly in this exercise the QL muscle. This movement is called a hip hike, and while it looks like it might not be doing much, it's actually incredibly effective because what we're trying to do is focus on working the QL muscle specifically and giving the other muscles in our body a break. Now, it's not that the other muscles in our body aren't working while we're doing this. They definitely are, but when we are focused and intentional on activating the QL muscle, it helps it strengthen much more deliberately than if we were just doing random movements without purpose. Now, we want to do this anywhere from 10 to 15 times. And if you want to make this more challenging, you can hold a weight on the side that is dropping so that we are increasing the difficulty. But I only recommend doing this after doing this exercise for quite a few days in a row. Make sure that we build up our tolerance with no weight and just our body weight first before introducing more weight onto this exercise. So by deliberately strengthening the QL muscle, we're giving our body the opportunity to build up tolerance and feel stronger, which then supports our spine so that when we're doing other activities, we feel strong and move with purpose throughout the day. All right, so here is that QL routine we just went over. For the stretch, we did some side bends. We did them for 20 to 30 seconds each side and 2 to 3 times on each side. And for strengthening, we did the hip hikers. We did them 10 to 15 times, and we can do 1 to 2 sets of those in this routine. All right, so hopefully this routine helped. There are some cautions that I want to let you know. If the pain ever gets worse or it changes in the type of pain you're experiencing, this is not a good sign, so we should stop these exercises and go see a trusted medical professional in our area. These exercises should feel gentle and they shouldn't ever make anything you're experiencing feel worse, so just keep an eye out for this while you're doing them. But hopefully this brought you some relief. If it did, I'd love for you to like, share, and subscribe to my channel for more exercises like this. If you are an over 50 active adult who's looking to build strength and resilience or just get out of pain and build a stronger body, I'd love for you to come join my free group. The link is in the description. In that, we have even more videos and exercises like this one, and we have nutrition guides and other great resources to help you in your health journey. And if your hip pain is coming from maybe even lower down and you would like to try more pain relief exercises, click here to watch this video where I go over the most commonly missed hip pain muscle that also sometimes contributes to low back pain. I'd love for you to check it out. All right, well, thanks for watching, and remember to always stay moving, and we'll see you in the next video. Thanks.